Our top story on KPIX5 and streaming on CBSN Bay Area, the dramatic shelter-in-place order for 6 counties in the Bay Area. Good evening. I'm Ken Bastida.
I'm Juliette Goodrich in for Elizabeth. Life as we know it will change drastically once midnight strikes. Now, here's what will stay open and what will shut down. Grocery stores, pharmacies, banks, gas stations, police and fire stations, public transit and sanitation will all remain open. Bars and gyms will close at midnight. Restaurants will move to takeout and delivery only. And some coffee shops will switch to grab your order and go. The order impacts more than 6.7 million people. It goes into effect at midnight tonight. And we have team coverage on this historic mandate. Let's start with KPIX5's Devin Feely live in San Jose. Devin.
Yes, Santa Clara County just recently announced that they have had 2 more deaths from coronavirus, and sadly we have become somewhat accustomed to county health officials announcing a new case or a death or new restrictions. But this meeting that they had here at the Sheriff's Office earlier today was different. Public health officials from 6 different counties and the city of Berkeley all in the same room acknowledging that this virus doesn't recognize imaginary lines on a map. It's a regional problem and as such requires a regional Bay Area-wide response.
A number of our cases are hospitalized and some requiring intensive care.
Dr. Sarah Cody, Chief Health Officer for Santa Clara County, the epicenter of the coronavirus outbreak in the Bay Area, says without the shelter-in-place order, the situation was on the verge of spiraling out of control, with an influx of new cases overwhelming hospitals, doctors, and nurses across the Bay Area.
We decided collectively that we needed to take swift action as soon as possible to prevent the further spread and to protect our critical healthcare infrastructure.
The shelter-in-place order goes into effect midnight Monday and lasts for 3 weeks, restricting all non-essential travel and shuttering all but the most important businesses: hospitals, pharmacies, grocery stores, gas stations, and banks. It will be up to the police to enforce the lockdown, but exactly how is still being worked out.
Obviously, our police department is not going to be out there enforcing at midnight tonight. It's going to take some time.
San Jose Mayor Sam Liccardo says local governments are also considering measures to ease shortages of food, hygiene products, and cleaning supplies.
There has been a lot of fear that has driven consumer behavior that is not helpful. We want to assure everyone that all the food delivery systems that we rely on every day and have relied on for decades are going to continue to be in place.
Cities and counties are coordinating with local charities to make sure that seniors and other struggling individuals and families have access to food in the face of an ever-tightening lockdown.
Now, for now, this is a legally binding order, but it leans heavily on the compliance of individuals. For now, there's not going to be checkpoints with police officers asking you if that trip to the grocery store, the gas station, or the bank really is essential. But the basic idea is the fewer people that you come into contact with, the fewer people that can get you sick, or if you're sick, that you can infect. In San Jose, Devin Feely, KPIX.
That's crazy, crazy new rules. Thanks, Devin. KPIX5's Andrea Borba joins us now from San Francisco, where Mayor London Breed said today that our behaviors need to change to stop the coronavirus spread. Andrea?
Well, Ken, she specifically wants people, like every other leader and public health official in the Bay Area, to stay inside. She says now is the time. We are at a critical moment right now. She wants people to distance themselves from everyone else and wants people to really take heed of this message. Until April 7th, public health officials around the Bay Area want people to stay home and try and stop the spread of the coronavirus.
Part of what we are also seeing is definitely a change in behavior, a change in what people do in our everyday lives. Many are calling this a new normal. Well, it's the new normal temporarily in an effort to protect public health.
One of the chief goals is preventing cases of COVID-19 in senior citizens who are particularly susceptible to the disease.
I want our seniors in particular and people that are most vulnerable to take this seriously. We could give orders, but if you don't follow it, it's useless. You all must do your part. We all must do our part.
Sidewalk crowds in San Francisco were already much thinner after the order. Also thinner store shelves as people rush to fill fridges, though Mayor Breed says that is not necessary.
grocery stores will remain open. The gas stations will remain open. The banks will remain open. The pharmacies will remain open. There's no need to rush out to do things at these particular locations because they will be available to you.
While things will be closed, there are ways to relieve cabin fever as long as good social distancing practices are maintained, like these folks at San Francisco's Fort Mason.
You will still be able to walk your dog or go on a hike alone or with someone you live with or even with another person as long as you keep 6 feet between you.
Now, this shelter-in-place order lasts until April 7th. It could be rolled back earlier if it is proven to be effective in stopping that curve of coronavirus cases in the Bay Area. It could be extended longer if it is not proving to be quite effective enough, and those healthcare workers need a break. Now, coming up new tonight on KPIX 5 News at 7 o'clock, we will take a closer look about what this means for BART, for Muni, for SFPD, what you could expect to see in the streets as this takes effect at midnight. Live in San Francisco, Andrea Borba, KPIX 5.